Hi, how you doing? I'm Dr. Adams at Natural Dentist Associates in Rockville, Maryland, and today we are doing a video about an eye PRF technique, which really helps us to grow a lot of high quality bone in our patients that have bone defects. Bone defects can come in the form of someone had a failed root canal that now is infected. It could be an area where a previous extraction site never healed properly, or it could be a site where we're removing difficult to remove wisdom teeth. All these are areas in which we want to get bone healing and bone growth. And PRF stands for Platelet Rich Fibrin, and the I PRF stands for injectable platelets. And there's many different ways in which you can put these things together. But long story short, really what you want to do is we want to get platelets, we want to get white blood cells, we want to get fibrin, we want to get growth factors, and the growth factors we're talking about are bone growth factors and gum growth factors, and you want to formulate these things into a product that can be easily placed in a person's mouth. And of course the platelets come from the patient's own blood. We draw the blood here in our office and we spin them in our centrifuge and we get these different formulations. And come on over here, I'm going to show you. This is a mixture that we've already prepared. Basically what we've done is we've taken vials of blood and we've spun them in a centrifuge to get what we call PRF, platelet rich fibrin. And it really, when you spin it down, looks like this yellow jello type thick consistency that we then kind of mush down on this plate, and it comes pancake thin, and then we take scissors and we chop it up into little pieces, and then basically what we have is very concentrated platelets and white blood cells and fibrin. And then we're going to take our bone graft material, which is right here. It looks a lot like kosher salt, and what we're going to do is we're going to put it in this dish. This is in the past basically what we've done, and that's it. This is a product that can be purchased from a pharmaceutical company, and in this case it's a human cadaver bone. And what I would do in the past, before we had all these neat platelet technology, is we would take the product that came from the pharmaceutical company, and this is the way it was always done in the past. We put a little bit of sterile water in there, and then we would maybe mix it with a little bit of blood from the patient's mouth to kind of get a pH balance, and we would place it in there. These crystals can be really difficult to kind of manipulate. They can fall out of place in the patient's mouth, and they really lack a lot of the growth factors, which is really the whole point of this platelet treatment. So what I'm going to do here now is, here, hold this for me for a second. I'm going to take the platelets, I'm going to put them in with the bone. Here, let me see this. I'm going to put a little bit of the blood concentrates in here. Here, hold that again. I'm sorry. Okay. And then we're going to mix it around. Go ahead and give me a gauze, please. And of course, this blood came from the patient. Really important that you use the blood from the patient. Of course, you wouldn't take the blood from a different patient. And when these products come from the patient's own mouth and we spin them right here in the office at the time of surgery, we can get the best results, because of course we are concentrating all the growth factors, and the growth factors are bone and gum growth factors. If you don't have growth factors, you don't grow a whole lot. The whole thing we're trying to do is grow bone. The other thing we have is we have white blood cells, and we're worried about infections. So we can take all this put together and we grow bone. We don't get a lot of infection, and we essentially get what we want. I get a flat surface here. You know what? Here, do this. What am I doing? Okay, there we go. Okay. Now, the next thing I'm going to do is we have another, is this the one that we just spun? Okay. This is a different platelet mixture. The PRF is made by spinning the patient's blood at 2,700 RPMs in our centrifuge for 13 minutes. And then it's very thick, as I said. And this is what we call IPRF, and the IPRF can be used for a lot of different things. I'm going to use it to drip on top of this to form like a nice gooey, clotty graft, holistic graft product that's made from the patient's blood that I can then use to repair the bone defect or get the surgical site where we're repairing bone to heal quickly. So I'm going to take this syringe, and what you want to do, here, come on over here, is you want to put it up against the side so you're not getting anything too thick in there, and you want to draw up. This yellow layer that I'm in right here, this is where all the growth factors and where all the platelets are and the fibrin. The red layer is where there is the red blood cells. We don't want that, okay? And actually this patient must be awfully healthy because there's a lot of what we want in here. The more yellowy this layer is, the better off you are. And actually that's really about all I really need. This is injectable PRF. Okay, so we're taking our injectable PRF. The injectable PRF is like kind of a thinner, runnier consistency PRF. And what you can do is this can be injected, like if somebody has like a gum defect or gum problem, you can actually inject this down into the gum. Some physicians will inject this stuff into people's knees if they have like joint issues. But what we're going to do is we're going to use it to, here, come on down here. We're going to use it to form like a nice bone graft product that we can easily deliver to the patient's mouth. I'm going to mush this down. And of course, blood clots. Blood products do clot. We've got clotting factors in here. So we're actually going to take advantage of that. I'm going to put a few drops of this platelet treatment here. And what we're going to find is in about 3 minutes, this is really going to clot nicely. Okay. And I'm going to save a little bit of this so that when we get into, put this into the patient's mouth, I can put a little bit more on there. So we're going to take a 3-minute break here. Yeah, go ahead. Okay, so we waited 3 minutes, and basically the whole point of this preparation is to get a mixture of the bone graft. Now this bone graft is actually cadaver bone. It's the only part of this product that did not come from the patient. But we have PRF, we have injectable PRF. These are two different formulas of platelets and white blood cells and fibrin. And what we do is we mix all these things together, as I've shown you in the video. And this would, of course, be delivered to the patient's mouth and in the area, the surgical area where there was a problem. But come on in here, and what happens is you start to get this kind of clot. It's kind of goopy and it's like gelling together. And that's really what you want. You want something that's going to goop and gel together, and will be a very concentrated mixture of the patient's own platelets and fibrin and growth factors. And this represents a major upgrade to the products that we used to do before, because what we would do before is essentially buy products off the shelf and put them in the patient's mouth. And now we're getting bone products, but we're mixing them with the patient's own blood. It's a lot better received in the body, We are mixing it with growth factors and white blood cells and all the things you need to prevent infection, get rid of infection, fight infection, grow bone, grow gum, do it very quickly, and have it result in high quality tissue generation. All right, that's it. Thank you very much. Again, I'm Dr. Adams from Natural Dentist Associates in Rockville, Maryland. This is our video about PRF and injectable PRF.